Colonoscopy is a medical procedure in which a doctor examines the inside of your colon, also known as the large intestine. The instrument used is called a colonoscope, a flexible tube equipped with a light, a camera, a water and gas pumping system, and an instrument channel at its tip. With the help of the camera and light, the doctor can clearly view the inside of the intestine. Water or gas is used to clean and open the colon, allowing better visibility. If polyps or abnormal growths are found, they can be removed through the instrument channel, or a tissue sample can be taken for biopsy. Let's understand why and how this procedure is performed. Colonoscopy is usually recommended for patients who have symptoms like rectal bleeding, chronic diarrhea, persistent stomach pain, or major changes in bowel habits. It helps the doctor identify internal issues and rule out serious conditions. In addition, if someone has a family history of colon cancer or polyps, doctors often advise undergoing a colonoscopy, especially after the age of 45, as a precautionary measure. This helps detect any abnormal growths early, which could potentially turn cancerous over time. Let's see how the procedure is done. Before the procedure, patients are advised to follow a liquid diet for 2-3 days. This helps soften the stool and clear the intestines. A strong laxative or sedative solution is then consumed the night before, which triggers bowel movements and thoroughly empties the colon. This cleansing is essential. The doctor can only examine the intestine properly if it's completely clean. On the day of the procedure, sedative medications are usually given through an IV line to help the patient relax or even sleep during the examination. This ensures the procedure is as comfortable and painless as possible. Once sedated, the doctor gently inserts the lubricated colonoscope into the rectum and slowly guides it through the colon. Since the scope is flexible, it easily navigates the natural curves of the intestine. Gas is pumped to inflate the colon for better visibility, and water is used to rinse and clear any residue. The doctor carefully examines the entire colon for polyps, cancerous growths, inflammation, sores, or any other abnormalities. If anything unusual is found, tools can be passed through the scope to remove it or take a biopsy sample. The biopsy is a process in which tissue cells are analyzed under a microscope to determine whether they are cancerous or not. A typical colonoscopy lasts between 30 minutes to 1 hour, depending on the case. During this time, the doctor ensures that every part of the colon is thoroughly inspected. After the procedure, the patient is monitored until the effects of the sedation wear off. A bit of bloating or gas is normal due to the air introduced during the exam, but this usually resolves quickly. Most people can return to their normal diet the same day. That's all for today. See you in my next video with another informative topic.